Kidney failure is a common ailment that typically affects cats, but it can also be deadly for dogs.
Yeah, Doctor Steven Haymore from Alpine Animal Hospital joins us today to talk about some of the warning signs to watch in your animals. And Dr. Steven Haymore, you brought a guest with you, Kristen, and little Peekaboo.
Peekaboo, yeah.
Oh, this is Peekaboo the cat. Tell us a little bit about Peekaboo.
Well, she's a rescue. She's declawed. We're not sure exactly how old she is, but we estimate somewhere between 16 and 18.
Okay.
But she does suffer from degenerative kidney disease.
Now, is this something that like with cats, it's not a question of if, but when, because that's
exactly right.
Generally one of the things that tends to go out as they get older, isn't it?
That's exactly right. That's exactly what I tell people often is, if your cat lives long enough, it's not if, it's when. They're a desert animal. They concentrate their urine. They don't drink enough. And I think they wear their kidneys out a lot of times. And if they live long enough, they get some degree of kidney failure. And with Peekaboo, so before we can see clinical signs and pick it up on blood work, almost 75% of their kidneys are not functioning properly.
Really? Is there a certain age approximately where you should start looking for signs of it?
Absolutely, yeah. Anything over, I would say, 10 years old, we should be testing at least once a year. I think we started testing before she actually was diagnosed. And it's been 2 years this month that we've been having her come into the clinic twice a week and getting treatment for it.
And what is involved in that treatment?
Very good question. So the kidneys aren't working. They're not properly filtering out the blood. And so we get a toxin accumulation of things in the blood. And so we don't have dialysis for cat. Well, we do, but it's not very realistic that we can do dialysis and filter out the blood. And so in essence what we do is we diurese the kidneys by giving them fluids, putting them on an ultra low protein diet, and that helps reduce those elevated values that we see in the blood.
And then how often does this need to be done then?
Good question. For Peekaboo, she comes in twice a week.
Twice a week.
Every Tuesday. A lot of people, and I know Kristen's done it in the past, has treated kitties at home with fluids. It's difficult with Peekaboo, so she's been coming in twice a week for the past 2 years, and we pump her up with fluids under her skin, the subcutaneous fluids, and she's been doing great. We just tested her last Friday, and her values were the lowest they've been since we started.
Oh, wow.
Excellent.
Wow. And so, Kristen, this has got to be great news for you, because the family pet, the family cat, has been able to live longer and be with the family more. How has that been as Peekaboo's owner? How's that been for you?
It's been wonderful, because she's a wonderful cat, and she's a daddy's girl, though, I have to admit. I'm the chef and the chauffeur. That's my roles. But she takes to the fluids very well. And it's prolonged her life, and it's made her quality of life absolutely wonderful. And that's what's important, I think, is keeping the quality of life.
Now, going back to the signs of this, just so people can have an idea of when they should maybe start worrying about this, what are the signs of kidney problems?
Great question, Libby. A lot of drinking and urinating frequently, weight loss, anything like that, acting sick, those kind of things.
It's like lethargy, they just don't want to get up and do
and most of the time it's a pretty gradual
cats finding
thing.
a sunbeam will be pretty lethargic, but outside of that sunbeam.
Right. It's a chronic condition, so that it's not something you just see very often, just turn on overnight. It's kind of a chronic condition that we see drinking more and some weight loss, things like that.
All right, so if people have questions about this in their cats or their dogs, they can contact you at Alpine Animal Hospital?
Absolutely.
All right,
thank you.
Very
fantastic.
Good. Christine, Peekaboo, thank you so much for coming in today, Dr. Haymore.
Thank you for having us.
And coming up next on more, working towards a personal goal can be exciting and rewarding.
How one man feels after he spent a century working towards his goal.